Good morning, everybody, and thank you. Thank you for the invitation to be here to speak about another example of experience on eHealth service. In these 10 minutes, I would like to explain you what the Veneto region realized related to eHealth service, what is the strategy, and how Veneto region obtained these results. Some information about Veneto region. It is one of the 21 Italian regions. Is composed of almost 5 million of inhabitants, and is composed also of 23 local health authorities and hospital trust. That in the 90s they start to realize the health information systems with different features and without integrated. So in the 2005, the local health authorities understand that the medicine was changing, and because the sharing of information between physicians, between government is very important, and so they would like to integrate the health information system, but they didn't have the forces to do it. And so they created a specific consortium that is Arsenal.it that support today all local health authorities in Veneto region in order to facilitate the integration of health information system for the realization of eHealth service. And so Arsenal.it produced for the local health authorities many specifications for the realization of eHealth service. Thanks to Arsenal.it that brought many European, regional and national projects, Veneto region realized the first big eHealth service. As you can see, the first important eHealth project, eHealth service, is related to the teleconsultation, in particular in telecounseling, service related to the digitalization of lab reports, one service that allowed the connection among general practitioners and local health authorities, many other projects related to PHR service, and then finally a big project related to the telemonitoring of chronic disease, for example, diabetes, COPD, and so on. This eHealth service are based on an interoperability approach. In this service, we applied many standards to allow the integration, in particular IHE profiles, interoperability profile. You can see a list of the profiles that we used, and this one is allow us to improve the approach to an health information exchange approach. So in the 2012, Veneto region started to work on the regional health information exchange. The health information exchange in Veneto region is focused in many services, for example, the digitalization of patient summary, the creation of tools for diagnosis and therapy. But we started in the realization of e-prescription and e-dispensation, because it was the first required by the government for cut the cost. This project is born after a list of legislation at a regional level, but also at a national level, because the government decided to require the realization of regional health information exchange in all Italian regions and the creation of a national federation. Arsenal.it is involved in this realization at the regional level. Okay, now I would like to show you what strategies Veneto Region applied in order to obtain the regional health information exchange. The first important strategy is to measure the status of the art, the maturity of the health information exchange, the health information system in the all local health authorities in Veneto Region. We involved the HIMSS. HIMSS is the #1 for the evaluation of the electronic medical record, and we applied the NRAM model. That is a list of questions, and this allows us to classify the health information system, the local health authorities, in one of the 8 stages. As you can see, the result of this evaluation was very positive, and thanks to this result, the Veneto Region decided to do the investment for health information exchange. The second important strategy is the application of standards and guidelines. Arsenal.it created many technical specifications, and all technical specifications are based on the IHE profiles. You can see the mainly profiles applied, and these profiles help us to realize the infrastructure. You can see the figure in the down, and but the health information, the specifications, the profiles helped us also to realize not only the infrastructure but also the standardization of the documents and the semantic, the workflow, and finally helped in order to management of the research. The third important strategy is the application of tools in order to evaluate and certificate the correct integration of the existing system in the Veneto region, in order to avoid problem in the production phase, and to allow the integration in the health information exchange. We used tools provided by IHE, that is Gazelle, is similar to the tools that is used in the connectathon. And thanks to this tool, we certified 42 systems in Veneto region for the e-prescription, dispensation, and also for the digitalization of lab reports. And we will use this tool also in order to certificate also the application mobile. Okay, now few minutes to show you also what is the application of the health information exchange for the patient, the citizen, and for the government. Related to the citizen, we started to speak about an approach called Health 0 Kilometer, because the result of the health information exchange is that reset the distance for the patient. And so for us, the Health 0 Kilometer is a list of services to reset the distance. For example, one service is an app for the health information exchange. This app that we realized help the citizen, the patient, to manage the e-prescription. For example, the patient can ask to the general practitioner to create again the e-prescription for chronic disease, drug for chronic disease, and other service. Then the health information exchange provide us many data, so big data. And the big data can use in order to, for example, to monitor the projects. For example, in this slide, you can see that I can, in Veneto Region, there is a dashboard that helps us to monitor how many general practitioners, for example, is linked to the health information exchange. The big data can be used also in order to monitor the health system at the government level. For example, I can see how many e-prescription a general practitioner create. And then the big data can be used also to analyze, to do clinical analytics for many contexts. Okay, so I try to show you what Veneto Region are doing, and if you need more information, you can see the links that can help us. Thank you.